The video coming after this was recorded on April 5th and uploaded to my personal channel. I'll leave a link in the description to prove it because everything I said in this video is common knowledge now. At the time I recorded this, most people thought the coronavirus lockdowns were just going to last a few weeks and everything was going to go back to the way it was before. This was and still is the only political video that I've produced to date, so hopefully the quality will get better over time. I made this video primarily to share with my friends as a single cohesive argument as to why the lockdowns were just a giant pause button and that there was no way life was going back to normal after 15, 30, or 45 days, or any number of days, until coronavirus had worked its way through society. In hindsight, I wish I'd been more explicit about recommending an alternative solution, which in my view has always been to isolate the vulnerable and try to move coronavirus through the rest of society as quickly as possible without overflowing the hospitals. Anyway, this video probably isn't going to change anyone's mind at this point, but it seems like a good starting point for this new channel, so here it is. On March 15th, the White House and CDC announced a set of guidelines in response to the early-stage outbreak of COVID-19 in the United States. The guidelines were called 15 Days to Control the Spread and urged all Americans to avoid non-essential contact along with other protective measures.
This afternoon, we're announcing new guidelines for every American to follow over the next 15 days. If everyone makes this change or these critical changes and sacrifices now, we will rally together as one nation and we will defeat the virus, and we're going to have a big celebration all together. With several weeks of focused action, we can turn the corner and turn it quickly. A lot of progress has been made.
Several states quickly announced full or partial shutdown orders, with many enacting mandatory stay-at-home lockdowns of all citizens. The remaining states who chose to encourage rather than mandate the preventative measures fell under intense pressure from media outlets to follow the lead of other states. By the end of the 15-day period, 42 states had some form of a stay-at-home order. During that time, the United States saw a steady trend upward of confirmed COVID-19 cases, mostly clustered in a few densely populated areas. But the increase fell well short of what would be needed to overwhelm medical resources, and in some states has barely tapped into them at all. On March 31st, Trump announced that he was extending federal guidelines through the month of April, acknowledging that the first 15 days had been largely successful, but stressing the importance of not creating an opportunity for the outbreak to restart. At this time, around 188,000 Americans, or 1/20% of the U.S. population, had been infected with COVID-19.
Our goal, which I believe we can accomplish, is to get the hotspot places, the New Yorks, the New Jersey, and help them to get around that curve. But as importantly, to prevent those clusters of areas that have not yet gone to that spike, to prevent them from getting that spike. And that's what I hope and I know that we can do over the next 30 days.
But what is at the end of those 30 days? Common sense, epidemiology models, and Dr. Fauci himself all acknowledge that the answer is nothing good. With only a fraction of the population immune to COVID-19, the only forces that could prevent an immediate restart to the outbreak would be a vaccine or possibly changing seasons.
So, Doctor, the idea of we understand that you can't know definitively how long anything takes here, but it's jarring to hear the president or anybody say, it's not about politics. This is going to be a couple of weeks and then we'll see, maybe July, and then hear about a plan for 18 months. What can you tell the American people?
But when you blunt the curve by modifying society, particularly with the rather dramatic physical separations, which people call social distancing, you can blunt it, but it is unlikely that you're going to make it completely disappear. If we're lucky, it will happen. But what more likely would happen is that we do this, go down, and if it's still around, we'd have to deal with it next season. That's the challenging issue. The good news about that will give us time to test and prove whether drugs are safe and effective. And as I've told you many times, the vaccine, whose trial we started just a couple of days ago, in a year to a year and a half, we should know whether we're ready to go. And that's not the only candidate.
That interview was filmed on March 20th, At that time, Dr. Fauci's plan relied on summer weather to hold the outbreak at bay until treatment options or vaccines were available. Even at the time, that was not a good bet, because researchers disagreed about whether changing weather would significantly slow the rate of the outbreak or not. In the time since this was filmed, Brazil has begun to see its own spread of COVID-19. Since Brazil is in the southern hemisphere, it is currently experiencing its summer season and has seen temperatures between 60 and 90 for the entire period that its outbreak has been occurring. Widespread consensus is beginning to form that the only end to this virus is herd immunity, achieved either through infection or vaccine. In the absence of a vaccine, long-term lockdowns have been singled out as the only option for flattening the infection curve below what can be handled by the medical industry. Jia County in China has already went from quarantined to reopened and is now back to quarantined. An online COVID-19 pandemic simulator hosted at covidsim.eu can be used to see what's going on. For a population of 330 million, a single infected individual triggers an outbreak that begins around 50 days later. With around 320,000 cases in the U.S., we are currently on day 85 of this model. The model does not account for scarcity of medical resources, but projects that an unmitigated outbreak would kill 763,000 people. The fatality rate is a configurable parameter to the model. Notice that the rate of infection grows exponentially at first and then begins to decay once herd immunity kicks in. At the peak of the graph, a single infected individual encounters only enough susceptible hosts to, on average, infect one more person. The model also allows for the simulation of various intervention measures. The most obvious is case isolation, or keeping the contagious people at home. Due to the large number of asymptomatic carriers, it's probably unrealistic to assume that a large number of carriers will self-identify and isolate for the duration of their contagious period. But if 50% of carriers are able to achieve 90% contact reduction, starting today and continuing through the year, we will see a significant drop in both the rate of infection and the total number of people infected. We also see a 100,000 drop in the number of deaths, because with less contagious people wandering around, less herd immunity is required to stop the virus from spreading. Unfortunately, this curve is too steep. A peak of 80 million simultaneous infections would overwhelm the healthcare system and drive the death rate way up. To flatten the curve, we use general contact reduction or social distancing. Again, we'll use today as the starting point and look at the effect of various periods and levels of social distancing. A 75% reduction in general contact, starting today and continuing for 30 days, only delays the peak about 2 months. The first month is spent social distancing, and the second month is spent climbing back to the current level. Then the outbreak starts again. The reason this does not work is because social distancing does not move the blue line or get us any closer to herd immunity. It also has no impact on the number of deaths, regardless of whether or not the scarcity of medical care is considered. The only advantage of this intervention is that the 60-day delay could be used to improve medical care. A more useful approach moderates the level of social distancing, but continues it for a much longer period of time. Under these conditions, the virus spreads through the community at a manageable rate, and herd immunity allows us to stop the measures once the blue line is low enough to prevent a future outbreak. Consider 25% social distancing sustained for 100 days. This period is just a little bit too short, because when the measures are released on day 185, we don't have enough herd immunity to prevent a spike. But continuing the measures for an additional 30 days gets us to the backside of the curve. What social distancing can't get us is a reduction in the unavoidable mortality rate of COVID-19. Our model assumed a 0.3% death rate, which would likely make COVID-19 the leading singular cause of death in the United States for 2020, slightly edging out heart disease. To save these people, absent a vaccine, we need to get to the backside of the outbreak curve without letting them get infected. Fortunately, for a large population, it's easy to predict which groups are likely to need and to not need medical attention. The predictions aren't perfect, as we've seen examples of young, healthy people succumbing to the disease. But our medical resources are capable of adequately addressing statistical outliers. What it cannot handle is widespread infections among the vulnerable. With targeted social distancing, it's realistic that we could get COVID-19 out of our lives and into the history books with a lower fatality rate than 0.3%. But that's going to require a level-headed approach that looks more than 30 days ahead. We need a set of long-term, attainable goals, a plan for achieving those goals, and a set of metrics for measuring our progress. Lots of people are going to die of COVID-19, and the sooner we accept that, the sooner we can start working toward minimizing the magnitude of that outcome.
As we started and we will end with its communities that will do this. There's no magic bullet. There's no magic vaccine or therapy. It's just behaviors. Each of our behaviors translating into something that changes the course of this viral pandemic over the next 30 days. Thank you.
Thank you, Deborah.
Thanks for taking the time to watch this through to the end. If you found it informative, please share it and help break through the extreme and hyperbolic rhetoric we've been hearing from all sides.